Good afternoon, everyone. We're going to start the webinar in just a couple of minutes. And it looks like we've got lots and lots of folks joining in, so we're just going to give everyone another minute or so to log in and get settled.
Bienvenidos a todos. Vamos a esperar unos cuantos minutos para que todas las personas se puedan conectar. Vemos que estamos teniendo muchos participantes asistiendo en este momento, así que empezaremos en unos minutos.
All right, everybody, I'm going to go ahead and get us started. We have quite a few participants logged on, and we have a lot to share this afternoon. So before we get moving, just another big thank you from all of us here at the Colorado Health Foundation. And I would like to share that we are providing simultaneous interpretation in Spanish for this event today. And so I am excited to introduce Andrea Psycho from the Community Language Cooperative, and she's going to explain in detail how that's going to work, including the interpretation feature in Zoom. So big thank you to the Community Language Cooperative team. And Andrea, I'm going to turn it over to you.
Thank you, Taryn. Good afternoon, everybody. My name is Andrea Psycho. I'm here with the Community Language Cooperative to help us all create a space of language justice where we can hear and speak in the language of our heart or in the language that we speak at home with our families. To do that, after I'm done saying this in Spanish, we're going to use the tool of simultaneous interpretation, and we're going to offer the interpretation in English and Spanish. After we turn on the interpretation, you're going to see a world map or three little dots or where it says more and on your screen, and you're going to be able to select your language. If you're fully bilingual, you do not need to select the language, as you will be able to hear in both languages whenever somebody speaks. But if you only speak one of those two languages, you need to select the language. If you only speak English, please select English once we turn on the interpretation. And do remember to stretch your words when you're speaking at conversational level. And if you have any questions, you can ask it in the chat. Hola a todos, mi nombre es Andrea Psycho. Estoy aquí con la Community Language Cooperative para ayudarnos a crear un espacio de justicia del lenguaje donde podamos hablar y escuchar en el idioma de nuestro corazón o el idioma que hablamos en nuestras casas con nuestras familias. Para hacer esto vamos a utilizar la herramienta de la interpretación simultánea y vamos a ofrecer interpretación en inglés y en español. Cuando prendamos la interpretación, tú vas a ver un mapa mundo en la parte inferior de tu pantalla o tres punticos donde dice More, y ahí vas a poder seleccionar el idioma de tu corazón. Si eres bilingüe, no tienes que seleccionar un idioma, pero si solamente hablas uno de esos dos, por favor, selecciona tu idioma. Si tienes alguna pregunta, puedes escribirla en el chat. Y les recuerdo que si en algún momento tienen la oportunidad de hablar, que estiren sus palabras para poder interpretar muy bien. To my panelists, please remember to select your language so when we start the interpretation so that we can practice language justice. And we can begin interpretation now. Thank you.
Thank you, Andrea. Well, hello again to all of you. My name is Taryn Fort. I'm the Senior Director of Communications and External Influence here at the Colorado Health Foundation, and also very fortunate to be part of our COVID-19 vaccine research and messaging team here internally at the foundation. So today we're going to be using the chat function for questions and comments throughout the event in English and Spanish. And we'd also like to ask all of you to share your name and the location that you are Zooming in from now in the chat. But I want to warn you that there is a little trick to using the chat function. So when you open the chat box, you're going to see a drop-down option labeled All Attendees and Panel Members. Please make sure that you're selecting this option throughout the course of the event today when you're sending chats so that everyone can see what you have to share. And again, if you just joined in the last minute or two, we're just asking everyone to share your name and location in the chat. Please go ahead and do that. Make sure you're selecting that drop-down option that is labeled as All Attendees and Panel Members. And I see lots and lots of folks are doing that. So thank you all. So a few additional accessibility and general housekeeping notes for today's event. So we do have closed captioning enabled, and we're going to be offering that today in English. So if you'd like to access that feature, you can find the closed captioning icon in the Zoom toolbar, which is probably on the bottom of your Zoom screen. And you're going to want to click the up arrow next to the icon and then select Show Subtitles. and that's going to ensure that the feature is working for you. We are also recording today's webinar, so we'll send the recording link along with all the resources that we're sharing today and that we've created. That'll be coming via email in the next few days, so keep an eye in your inbox for that. And then finally, we do have lots of folks on the line with us today, almost 200, I think, if I'm seeing the participant number right. So we've muted audio to minimize all that background noise. And again, are asking you all to use the chat for questions and comments in English and Spanish. And so again, a big welcome. Thank you all. Welcome to our webinar on COVID-19 vaccine hesitancy messaging. So for those of you who maybe are not familiar with us, or maybe even just a little bit, here at the Colorado Health Foundation, our mission is focused squarely on bringing health and reach for all Coloradans. And we do that work in a whole lot of different ways, predominantly by engaging closely with communities all over the state of Colorado through investing in grant making, through policy advocacy, through convening and capacity building of all different types within the nonprofit sector. And of course, also through moments like this one today, in which we're sharing how our public opinion research is being used to better understand and advance health equity in Colorado. So during the webinar today, we're going to be discussing our in-depth research and messaging project that's focused on building confidence in the COVID-19 vaccines among communities of color across the state. And through this research, we've gained some really critical understanding about what's behind the hesitancy to get vaccinated. And we've also tested approaches to provide Coloradans of color with the information they need from the people that they trust in a way that they need to best engage with it. So in our time together, we're going to hear a quick and short presentation from Jace Woodrum, who is our Senior Officer of Public Opinion Insights. And then we're going to move into a facilitated Q&A session that's going to be led by our Senior Director of Policy, Kyle Rohaus-Legleiter. So again, we're going to be taking questions via the chat. If you have any technical issues, send those to us via the chat as well. And with that, I'm going to send things over to Jace.
Thanks, Taryn. Trying to get all my Zoom stuff going here all at once. It's like a grand debut. Turn on my mic, turn on my video, turn on the PowerPoint. Hopefully everybody's hearing me right now. Welcome. I will echo Taryn's thanks that you decided to spend some time with us to talk about effective messaging through building trust, sharing information, and inspiring hope. I'm really excited to have you all with us. And I'm going to dive right in. There's a lot to get through today, and I want to make sure we have plenty of time to hear your questions. So last fall, I'm going to take you back. Last fall, we were all hearing about the COVID vaccines becoming available. And we at the Colorado Health Foundation wanted to understand, what do we do? And so we set a goal to focus on vaccine equity, specifically racial equity and vaccine uptake. And when we set that goal, we had a bunch of poll numbers that said, okay, there's a lot of hesitancy among communities of color. Since then, we have actual data of who is getting vaccinated. Here it is. As you can see, Black and Hispanic Coloradans are not being vaccinated in proportion to their population size like white Coloradans. Now, other communities of color, such as Asian Coloradans or Native Americans, are roughly on track. That's not to say we shouldn't be really careful and watch those numbers as we continue, but we're about 8 months into vaccinating, 9 months into vaccinating folks, and there remains a disparity for Black and Hispanic Coloradans. Now, we know there are many reasons driving these numbers. I mean, it's hard to find information in languages other than English. It can be difficult to get time off work. It requires digital literacy to make an appointment. All of those access problems are totally real, and we also have a hesitancy problem, and hesitancy is also real. And I'm saying that with a lot of confidence because I've done about 9 months of research on this issue, and I've talked to a lot of Coloradans, and I've heard loud and clear what is driving hesitancy, what factors are people weighing as they consider this decision for them. Here's all the research we've done. It's an overwhelming slide, and I got to tell you, it's been kind of an overwhelming project. We started with a landscape phase where we sort of understood what were we walking into. We looked at public health literature, we looked at existing public health messaging, we looked at 400 media articles, we looked at what people were saying on social media. Then we put about 30 Coloradans in an online discussion board for 7 days, and we talked to them about the vaccine. And interestingly, while they were in that discussion room, coming in and out of conversations, the very first healthcare workers got their shots. And we all saw the media just light up with that coverage. So we got to see how real people getting vaccinated changed people's calculations. Then we had 18 two-hour online focus groups. We conducted those in February, March, and April. These are long conversations with groups of 6 or 8. We really got to talk about what were people feeling as they considered this decision. And we also began to understand, who do they need to hear from? How do they need to hear about the vaccines? And then finally, we did a poll of 1,500 Colorado adults. We talked to both vaccinated and unvaccinated folks. So we can compare their differences, and we oversampled Hispanic, Black, Asian American, Native American. I'm also getting some text that maybe these slides are a little bit blurry. Is that happening for folks?
Jace, yeah, they're just a little pixelated, a little bit difficult to see.
I think I have a fix for that. All right, folks, I hope that is better. Suffice it to say, we've done a lot of research, and we've really dug deep into this work, into understanding hesitancy. And then ultimately, our goal isn't to just understand hesitancy and think, wow, that's interesting, but it is to understand how we can help people get the information they need from the people they trust in a way that they can hear it and process it to make the right decision for them. And so before we talk about what we've learned through the research, I want to take you behind the scenes into a focus group we conducted with Hispanic Coloradans. I can't show you their faces. We promised them anonymity, but what I can show you, or I can share with you, is their voices. The conversation that they had, it's about 5 minutes long, and it's with Hispanic women and Hispanic men. And these were done in English. We have some focus groups that were also done in Spanish. Today, I'll be showing you the conversation in English. And I just want to take you behind the scenes so you can hear how difficult this is for people. Because for those of us who made this decision easily, who said, please sign me up, where's the needle, right? I want us to all remember that it's not easy for a lot of people. And those are the folks who need to hear from us the most. So it's really important that we come to them with empathy. So I'm hoping that I can make the tech work here. So let me give it my best shot. You should hear talking immediately. And if you don't, I hope that one of my colleagues will interrupt me and say that they're not hearing something. But here we go, behind the scenes, audio only with Hispanic Coloradans.
A lot of misinformation as well, and just miscommunication. I mean, you have some people saying that it's nothing, or that it's a hoax, or that it's just, it's not as big of a problem as it should be. It's hard to know whether we can trust numbers or not. We've heard numbers might not be accurate. We've heard that hospitals are misreporting people, or saying that other patients have died of COVID to get money. So I just feel like I don't ever know what to believe.
Yeah, I mean, with all the new strains and variants, it just feels that a vaccine is really not going to make it. It's not going to make a difference maybe at some point, right? So then why would you even bother to put this vaccine? Vaccines, sometimes they do hurt your body. So I don't know if I want to go through that risk if it's not going to be worthy.
Any questions that you guys would have, and certainly I don't know anything about anything, but if you could ask someone who knew stuff, what are some things you would like to know, or some unanswered questions that would make you more sure, I'm hearing pregnancy. I'm hearing I have a certain health condition. What about the variants? Any other questions that we have at this point that would help to know?
What percentage of the population needs to get this vaccine for it to really be effective?
Yep. What else?
How often do we need to get vaccinated? Yeah, because we take the flu shots every year. So will it be the same with this one?
Side effects.
Proof that it actually functions the way that it's supposed to.
And why would I want to put more stuff into me?
I would like to know if this could be mandatory.
Being pregnant would probably be a really big question because you don't know how it's going to affect your unborn child. And also, what is in that vaccine? Can it cause breast cancer? Can it cause something else that you don't know, or exacerbate something that you might already have and make it much more active inside your body? So it's kind of scary.
What is in the vaccine? What is there?
Like ingredients or?
Yeah, how they made this vaccine, what they put in.
Yeah, I agree with the, what is in the vaccine? How are all of the vaccines different from each other? Give us the actual science of how it works. Even if we don't understand it, at least it's more information for us to digest and to try to break down.
I'm not big on vaccines, and I believe in don't fix it if it ain't broken. I've been doing fine. Never done the flu shots. I've been around people numerous times exposed and kissed and hugged from my family. I don't want to be forced to take it. I think that's against my civil rights.
Larry, definitely not. Tell me a little bit about what you're weighing in your mind when you say definitely not.
There's a lot of things. Well, Bill Gates was behind it, and I've never seen him make a computer system that didn't get a virus. I don't trust the scientists behind it right now. I really don't. I mean, they waited until Trump wasn't in office to announce that they had the vaccine.
Right now, I'm still unsure. I want more information, how it works on the body. And long-term, that's another part that I'm unsure about, are the long-term effects. So maybe after a year or two watching people get the vaccine, I'll know some more of the effects and I'll be a little more ready to get one then.
And regardless of how we feel, you guys, if you were to talk to a family member or a friend to tell them that they should get the vaccine, what would you say in your words? What are some reasons you might give someone to say, hey, yeah, you should get the vaccine?
I think I would bring up the fact of that the vaccine, unlike many other vaccines, is not a small dosage of COVID. Look, I just learned that. And I think a lot of people, for those people that understand that most vaccines they give you a small dosage of that disease, so you can develop antibodies. I think that's kind of a selling point for people that are on the fence.
So imagine 2 hours of those conversations, 18 different times in a couple different languages. It was a lot. And the purpose is really to understand, to listen, to understand the mindset of the vaccine hesitant. And if watching that makes you have a lot of questions, I would encourage you to put them in the chat. Some of my colleagues are watching the chat and can respond, and there'll also be Q&A time. So if that brought up questions for you, I hear you. It brings up a lot of questions when we talk to people and we hear from Coloradans. We're fortunate that we were able to really go deep and to do the number of focus groups that we did and to do the size of the poll that we did, so that we have a really deep understanding of the mindset of the vaccine hesitant. I could talk to you for hours and hours. I won't. That's not this kind of webinar. But I just want to lift up 4 key learnings about the mindset of folks. And I want you to keep thinking about these folks. I'm going to call them the vaccine hesitant, but I would encourage you to think of them as the folks who need to hear from us. The mindset of the folks who need to hear from us. And the first thing I want you to know about the folks who need to hear from us is that they're on a spectrum. For most of us, for many of us, deciding whether or not to get vaccinated is not a simple yes or no question. there's a spectrum of mindsets, and there are complex reasons why people are where they are. So when we look at this spectrum, on the one end, we've got saboteurs who will refuse to take the vaccine and try to dissuade others, all the way to ambassadors who will take a vaccine and encourage others to take it. It's super important that we don't oversimplify the reasons why people are hesitant, and that we don't make assumptions about where people are. So I don't want us to say, to make an assumption that different racial groups are green or orange, or different age groups are red or yellow, right? It's each person's reasoning and their place on the spectrum is as unique as they are. And so it's really important that we, again, come at these folks with empathy, and remember that we have to focus right now on those who are available to us. Many of us dream of convincing the hardest to convince people. Like I've often dreamed of myself like fighting on Fox News with Tucker Carlson, but that's not actually our path to victory here. Our path is to talk to folks who are available to us. And the research suggests that we focus on those who are hesitant, who you see here in yellow, those who are skeptics, and those who are resistors, who are in orange. And that for right now, we not spend our time and energy on those folks who are in red, who are not available to us. And we'll talk about that a little bit. The second thing I want you to know about the mindset of those who need to hear from us. People are incredibly well informed. I mean, we're listening to folks in focus groups talking about mRNA technology, how long it took to develop the polio vaccine. They know the names of pharmaceutical companies that are manufacturing the vaccine. This is a tremendous amount of information that people have and are holding, and yet they still have questions. Now, some of those questions are about their own unique health conditions. Some of the questions are complicated, but very possible to answer. You heard some of that in the focus group. The question, what's in the vaccine? Tell me the ingredients. This first quote is what somebody said in the audio. What is in the vaccine? Give us the actual science, even if we don't understand it. At least it's more information for us to digest and to try to break down. The hunger for that information is really, really huge for folks. Now, some questions don't stem from the fact that, how will this interact with my diabetes or my heart condition? Some of the questions they have stem from the fact that they don't know if they can trust the information they do have. That's like the second quote. It's weird because there's been so much information, maybe misinformation. And so I know for me and my family, we can't go off what the media says or how you feel about it. And this concern about misinformation really came through also in our survey when we said, hey, do you feel like you can find reliable and accurate information about the vaccines? And over a quarter of people said, I can find information, but I don't know if I can trust it. That means people are in a really difficult place emotionally. And that's the third thing I want you to know about the mindset of the folks who need to hear from us. People are emotionally drained by COVID. Not just the sickness and death, but also the closures of businesses, remote learning, financial struggle, job loss, changing mask mandates. People say they are over it. Word for word, look at that first quote. I am over it. I am so over it. I'm on the fence about it if it's real or not. Right? So there's just a lot of anxiety and a lot of fear. And people are kind of over that feeling. That's not a happy emotional place to be in. And so all of this has led to an incredible distrust of the government and the medical community. And of course, we know from many communities of color, distrust with government and medical community is warranted and has existed long before COVID and will exist long after. So take a look at some of these quotes as an example of that from a Native American man. The last time we trusted someone, we were infested with smallpox. This social distancing is like changing the whole dynamic for children, separating everyone, making everyone scared. That is a psychological thing, like manipulation for sure. I don't really trust the government, honestly. So the distrust coming through, these are some really strong words from folks. Layer into that hesitant people are more likely to lack direct experience with serious COVID cases. Which means they're more likely to dismiss the dangers of COVID. and they feel like it's been overblown. So that's just furthering the distrust. So look at this. We've got majorities of people in our survey saying that they've heard media reports about COVID are overblown. 54% saying they think it's been overblown by hospitals, drug companies, and others who are trying to use the pandemic to turn a profit. So a lot of distrust. And the last thing I want you to know, people are trying to make this decision and they are weighing the risks and the benefits. That's the calculation they're having, right? They're weighing the concerns they have about the vaccines against the concerns they have about getting seriously sick from COVID-19. And as they're doing that weighing, right? When we all struggle to make a decision, we've got things that influence that weighting. And for most folks who are hesitant, it's the information that they have, which is a lot, but maybe they can't trust it. And maybe it is misinformation. It's their personal experiences, and it's the emotion that they're in. And we already talked about what a difficult emotional place people are in. And it's pretty common that vaccines, including COVID-19, trigger anxiety about injecting foreign substances into our bodies. So let's take a look here at the first quote. I have a pre-existing condition. I am on multiple medications. I'm willing to take my chance of battling it instead of injecting something that hasn't been tested and tried, right? So that's anxiety about injecting our bodies with foreign substances. It's a very natural anxiety, and it's a hard anxiety to overcome, especially with some of these numbers you see here. You see 38% of people who are unvaccinated who took the survey believe that the vaccine is riskier than the virus, 38%. And then 55% say they don't know anyone who's gotten really sick or died from it. So as a result, many hesitant people say they're just willing to take their chances. They believe they can fight it off. You heard some of that in the focus group clips that I shared. And this quote is another example. It's not going to do me any good. I honestly don't feel it will do me any good. I have a good immune system. I take care of myself. I am healthy. So I shouldn't even have to worry about it. To me, it is like cold. So a lot of people believing that they can fight it off. And in fact, there's a sort of holistic or natural or alternative living group of companies. There's a narrative out there, an anti-vaccine narrative that says just that. Maybe a collective deep breath is in order because that was a lot. And it may have felt like a lot, especially for any of us who have experienced trauma over the past year, or for those of us who have been doing the hard work of having conversations with people who are hesitant. So if that felt like a lot to you, you are not alone, and a deep breath is 100% welcome and in order. As you saw in the video, the audio clip and the quotes, hesitancy is a real problem that we have to address. So what do we do about it? The good news, it's possible to overcome hesitancy and build confidence in the vaccine. Bad news is it's pretty hard to do. But there's more good news than bad news. Through our research, we developed a 3-part messaging formula for overcoming vaccine hesitancy. Build trust, answer questions, inspire hope. We tested it first through focus groups, and then we put that formula to the test in a survey of Coloradans. And I want to talk you through how it performed. Here's how we put it to the test. We created several videos with real-life people following the 3-part messaging formula: trust, questions, hope. Right? We showed these videos to the folks taking the survey, and we measured how effective the videos were at addressing their hesitancy. So what videos you saw is based on who you are. So if you were Black, you saw Ryan and Dr. Piggott. If you were Hispanic and taking the survey in English, you saw Olga Gonzalez and Jimena Leon, she's a nurse, and so forth, as you can see here. And one way we measure the effectiveness is through dial testing. So that's a way we learn in real time. So participants watch the video and listen to it, and when they hear something that makes them more comfortable about getting the vaccine, they press the up arrow key. When they hear something that makes them feel less comfortable about getting the vaccine, they press the down arrow key. So we see in real time, and then after the video is over, we ask a bunch of questions. Did you find this person trustworthy, or blah, 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 like go into some after the fact, after we've processed, the not real time. I hope that made sense. Put your questions in the chat if it didn't, because I want to show you a couple of these videos so you can see how survey participants responded to this 3-part messaging. So when I show you the videos, here's what you're going to see. I just sort of want to orient you. The video, you'll see the spokesperson and you'll see lines across their face. So it might be a little bit overwhelming at first. Don't worry, you're not alone. Might feel like a heart rate monitor. We all are seeing that same bit of chaos. Now, the green line represents people who haven't been vaccinated yet, but they're like, yeah, I'm going to get vaccinated soon. Then that yellow or sort of orangey line are people who say, I'll probably get vaccinated. And people who say, I probably am not going to get vaccinated. And then the red line is people who say, absolutely not, no way, no how, not going to do it. So as you'll see, as this spokesperson is Ryan, as Ryan talks, you'll see the lines go up and down, and sometimes you'll see the red line go up and the other lines go down and vice versa. And that's how we learn what people need to hear and the kind of people they need to hear it from and how they need to hear it, right? What sort of tone matters and that sort of thing. So I want to show you a video, but I do feel like I need to pause and let my colleagues jump in if there are questions about what is about to happen on the screen. Are there questions that have come up in the chat about what I'm about to show you?
I think you're good to go, Jace.
Thanks so much, Taryn. Just wanted to make sure. Okay, so let's hope that technology doesn't fail us again. I'm going to ask you all to try to find the messaging formula in what you watch here. So I'm going to remind you again, build trust, answer questions, inspire hope. That was the messaging formula that we were testing here. And see if you can pick out the different elements that do that and notice where the lines are. And I would encourage you, nay, challenge you to follow the green and the yellow lines. Despite our temptation, it is ever-present temptation to follow the red and to convince that Tucker Carlson with your amazing arguments, but I'm going to encourage you to follow the green and the yellow. So here we go.
My name is Ryan Cobbins. I live in 5 Points with my wife and 3 little girls. I am the owner of Coffee at the Point. I first remember hearing about COVID, reading the news that indoor dining was closing for restaurants. And I just remember sitting and thinking, I have no idea how we're going to make it the next day. And I don't think what they realize is that, you know, we still had payroll. Throughout this pandemic, one thing that was important to me was to ensure that we kept our doors open. I wanted to make sure that we kept our staff getting checks any way that I could. And then we start wearing masks, you know, and a smile means a ton to, as a Black male in the US, I wear a smile to defeat the stereotype that I'm a aggressive, overly brute Black male. And so a smile to me, it helps me diffuse a whole lot of things. Covering it up with a mask, I'm like trying to squint my eyes as much as I can just to make sure folks know that I am smiling. So it's been tough. I have been called the N-word this year in the last 3 months, probably from 5 or 6 different people. I have conflicting views. Number one, I hate needles. I hate needles. But, you know, you are here one day and you're gone the next. Do whatever you can to stay here for however long that you possibly can. I want my kids to be able to hug their friends. It's important to take the vaccine for my family because I want to make sure that my family can see each other. I want to make sure that my 70-year-old mom and dad are alive to where not only am I walking my daughters down the aisle, but grandma, pops, nana, they're all sitting in the front row as well.
Okay, some of you may know Ryan. Ryan was our top testing messenger. You saw all those pictures of those videos. His video performed the best, and I'll talk to you in a minute why. But just to make sure, so all the videos, all the lines start at 50. So when they go up, they're only going up in a that's a positive way. And you see sort of where we land. Is this number right here is 69. So we've got green well above 69 and doing well above majority with yellow as well. Not really majority, right? But that's how this works. So Ryan, remarkably talented messenger. And here's why. First, perhaps the most important thing that Ryan did was he talked about his own journey story. Ryan was hesitant, right? Doesn't like needles. And that helps us so much when talking with folks who are hesitant to share the journey that we have been on. What helped us decide is a really important piece of the puzzle here. The other thing that Ryan did was talk about his struggles with racism during the pandemic. And we asked folks after they watched the video to give some open-ended comments, just an open-ended, a response. And here's what a Black woman said in response. I absolutely felt every part of that video. During the pandemic, racism has been at its all-time high. Being a Black woman in America, we are easily stereotyped. And so really felt that video, felt that part of Ryan's story. And let's remember that only unvaccinated people. So the poll contained all that vaccinated and unvaccinated people. We only did the message testing of somebody who's unvaccinated. So this is somebody who's unvaccinated talking about Ryan's video. Ryan talked about putting his family first. He talked about putting his employees first, his concern, wanting to make sure that he was able to make payroll. That all helps. And then the last piece is what you saw on screen, the numbers of people being vaccinated and how that was helpful. So if you go back to that messaging formula, how does Ryan build trust? Well, he talks about his own journey story. He talks about his struggles with racism. He talks about his concern for his employees, right? So he builds trust through all of those ways. He talks about, the words on screen of the numbers of people getting vaccinated. That's really helpful information. It answers a question people have. It provides them with good information. And then he inspires hope by talking about his family and the vision of walking his daughter down the aisle and everyone being there to watch. So Ryan follows that three-part formula, right? It doesn't necessarily follow in order. The first thing that we do is build trust. That's the first and most important thing that we do. And then these other pieces, I wanted to demonstrate that because it's not a playbook and it's not a read from this script. There are a lot of different ways to execute this messaging formula, and a lot of different ways can be effective if we focus our time and energy on building trust first. I'm going to show you one more video, and then we'll do some Q&A. And I had a hard time showing you. We have 4 videos that did just remarkably well. I had a hard time picking which one. I chose to show you a nurse because we know that healthcare providers are an important messenger here. Now, I will say that everybody can be a messenger because people do want to hear from their family and friends. They don't want to be pushed. They don't want to be forced. Nobody wants to be forced by anyone. But if there are family and friends and neighbors in your life who aren't vaccinated, it is helpful for you to engage in a conversation. And we have some resources that we've put together to help you know how to engage in those conversations. And then, of course, Ryan is a business owner. One of our other top testing messengers runs a nonprofit organization, Olga. And so, they don't work in the healthcare space, but they have a great, powerful messages that they're bringing. And then healthcare messengers, we know they're critically important. And so we tested both doctors and nurses. And I will show you Jimena. She's a nurse from Telluride. And I'm going to challenge you again to look for that messaging formula. And maybe most importantly, what does Jimena do to build trust? And don't just listen to her words. I want you to listen to how she talks and how she comes across, which we've heard time and time again. We tested Jimena in both focus groups and on the survey. Matters a lot to people. So let me show you Jimena, and then we'll hopefully do some Q&A.
My name is Jimena Rebolledo Leon. I am a registered nurse at the Telluride Regional Medical Center. I think for as long as I can remember, I grew up with my mom, all of us immigrants, and my mom delivering food and clothes to other Latinos that were less fortunate than we were. So I grew up with a role model that exemplified this is what you do to help others. And nursing seemed like a logical next step. I've always been drawn to helping others because I am a Spanish-speaking Latina nurse that has been in this community for 20 years. I just have a lot of folks, over 200 Latinos in our town that have my personal phone numbers. Once the pandemic started, there wasn't enough information being shared in Spanish for our Spanish-speaking population. So I started creating videos and posting them on online. Pues yo cuando llegué a este país como inmigrante, yo sé de primera mano cómo es tratar de evitar de ir al doctor. Yo me acuerdo de tener una tos y mi mami me ponía diario debajo de mi pijama para que sudara. Mi mami tenía 1000 métodos que trataba. Yo como mamá, aunque sea enfermera, siempre trato de darle al cuerpo la habilidad de combatir las cosas en una forma natural. Cuando salió la vacuna, yo pensé inmediatamente, no gracias, yo espero. Inmediatamente me sentía sospechosa. Y ahora que hay millones y millones y millones de personas que han recibido las diferentes vacunas por todo el mundo, me sentí como que, ok, sabemos cómo esta vacuna se está comportando, qué está causando. I think it's very important to fully understand what it is that people are undertaking when they decide to be vaccinated, because there have been betrayals of trust in this country's history. But I do encourage anybody who has any hesitancy to seek more information and to reach out to folks that you know you can trust. And I don't mean Facebook pages or your uncle in another town. I mean, reach out to healthcare professionals, public health care professionals, because those are the folks that are doing the work. I think once my family gets vaccinated, the thing that I'm looking most forward to is reuniting with the rest of my family, somewhere where we can just kind of get away from this current reality and just relax a little bit. That's what I'm really looking forward to.
So look how high these numbers end up. Pretty good for Jimena. Now, if you're saying, how on earth are these videos going to work? They look like you made them, in a garage. You wouldn't be that far off. We filmed these over Zoom. We talked to these messengers for about an hour. We filmed the conversation, and then we edited it, and it's not beautiful, right? People's internet was going in and out, and all kinds of stuff was happening to interrupt, dogs barking, all kinds of things. But you know what? In the research, we really found that didn't matter, because what that did was that made people feel like they could trust these videos because they weren't so slick that they didn't feel like they were being pandered to or manipulated or trying to be convinced. It felt like they were sort of having a conversation with Jimena, and that's part of what worked well about all the videos. And specifically about Jimena, and I'm guessing that many of you, caught many of the things that she did to build trust. She talked a lot about helping Spanish speakers, immigrants, and Latinx people in her community, and that built a ton of trust for people. She has some built-in trust as a nurse, but remember I said earlier, the distrust of the medical community is really alive right now. And so, she doesn't have quite as much as a nurse naturally would, because of the distrust that exists right now. So she builds it up by talking about how she is a nurse who engages with community and makes those videos, and helps people, with the people on her phone. She talks about how getting a vaccine is a decision that everyone has to make. And you probably saw the red lines going up. Red line folks really, really support that, but the other lines do as well. And then, like Ryan, she talked about her journey story, right? She said, I said, I'm gonna wait. No, thank you, I'll wait. And so that journey story is incredibly important for all messengers for whom it is a real valid thing. You were hesitant. That already makes you such a powerful messenger because you can talk about your journey. Three-part formula: build trust, answer questions, inspire hope. I told you we tested it, right? We put it to the test. We wanted to know, is this gonna work? Not just with the 8 people in our focus group, but is this gonna work? And I also promised you there was good news, and here is the good news. It worked. At the beginning of the survey, we asked people about their plans to get vaccinated. Then we showed them anti-vaccine messaging and our messaging, including the videos. Then at the end, we asked them about their plans. The survey showed that we were able to move people to feel more confident about getting the vaccine by exposing them to our messaging, even in the face of anti-vaccine messaging. So we increased the group of people who were more likely to get vaccinated by 5 points, and we decreased the group less likely to get vaccinated by 7 points. Now, people move along the spectrum. Remember back the slides to the spectrum of vaccine mindsets? People don't go from saboteur to sign me up, right? That's not how people move. They move to the adjacent possibility, sort of, they move next door. So we saw people move from definitely not to not sure. We saw people move to unsure to I'll wait longer, from I'll wait longer to as soon as I can, right? People move along the spectrum, but the point is they moved, right? This is what we were testing. This is the test of the messaging formula. And we feel excited that we have movement. This isn't the only way we measure the movement. We also asked people when they'd get the vaccine. So when do you think you are most likely to get a vaccine, if ever? And we saw a 7-point increase in the people saying they would get it in 1 to 2 months. So we essentially went from a quarter to a third of unvaccinated Coloradans saying they'll get it in the next 1 to 2 months after hearing our messaging. Pretty exciting for us to see that the formula that we had worked on moved. And so we've been since then trying to put together resources, tools, all kinds of stuff to help people use that formula in their work. There's a couple more things I want to show you. So this is your chance to put those questions in the chat if you haven't yet, because we're turning there next. I just want to flag who this target audience is. So let's imagine this pie as all unvaccinated Coloradans. Of those folks, 65% are movable. That is to say, we believe that our messaging can have a positive impact on 65% of those who remain unvaccinated. That means 35% are hard nose as you look at the pie. And so I want to encourage us to focus our energy on that 65% and try to move them along that spectrum from resistant to hesitant, hesitant to skeptical to hesitant, hesitant to acceptor, right? We'll move them along. Maybe our hard nose will change their mind 6 months, a year, we don't know. But for now, it's really important that we focus on this 65%. And I wanted to lift this up because I think sometimes we feel like only people who are left are anti-vaxxers. They don't ever get vaccinated. Or some people think like everybody, we've talked to every single person who's left. And I want to sort of split the difference here and say, no, everybody who is left is not an anti-vaxxer. there are people who are hesitant who need to hear from us. And that's who we need to talk to. And they make up 65% of the unvaccinated people. Okay, Kyle, start queuing up your questions. I just wanted to provide a introductory list of the resources that we have available. We really want to make these available far and wide. We've got, excuse me, a full messaging guide, a shorter one, excuse me, frequently asked questions, trusted sources, for folks who want to watch the focus groups. I have those. If you want to dig into the survey results, I have those. We're making a model to help target who we reach out to. And we've got a team available to provide consultation and support. Excuse me. So that's what I got for you. Questions?
Thank you, Jace, and thank all of you for joining us for this conversation today. My name is Kyle Rojas-Legleiter. I'm the Senior Director of Policy Advocacy at the Colorado Health Foundation, and it's my honor to take us through a deeper dive into some of the questions that you all have shared in the chat as you've heard our presentation today as well. So do not be deceived by the visual on the screen. This is not just a conversation between Jace and myself. This is a conversation inspired by the curiosities that you all lifted up as you were hearing what we've shared so far. And I want to start with one that we got back at the beginning of the conversation, asking about whether or not we should be talking about folks as vaccine hesitant or vaccine impeded. So Jace, I'm curious what you hear in that question in terms of some of the remaining challenges with access that you lifted up at the beginning, and how we should be appropriately thinking about the folks who haven't yet been vaccinated in Colorado. And this sort of, it relates to what you left off on just now as well.
Great, thank you for the question. Thanks, Kyle, for coming in and giving me a water break and going through all the questions that you all have. So I think there are access challenges, and I said that at the top. There are things standing in the way of people getting vaccinated, and navigating those, working with folks to get that support is work that is happening, and many of you watching probably are doing that or have been. But I think what we have also seen, hearing from folks who have been staffing those clinics and doing all those things, is that sort of demand has decreased across the board. So, because there's been good navigation and support happening, I'm not suggesting that the barriers have all been handled, but there are amazing organizations out there that are helping individuals navigate some of those, and outreach to those individuals who are running into access barriers will continue. And then we have a hesitant population. And the hesitant folks are not the people who are having an access barrier. They are actively unsure about whether or not they will get vaccinated. And that's what we were, of course, talking about today. I'll leave it at that. Go to the next one.
Thank you, Jace. We got a number of questions I sort of grouped together in a theme about who we heard from when we did this listening, when we did this research to really arrive at this formula, the conclusion, some of the recommendations and resources that we lifted up at the end and all that. And I remember you describing this as like a journey of many parts, where we were listening to different people in different ways and different phases of research through all that as well. So the answer has some nuance behind it. But there were questions like, was the population of folks that we heard from, that we tested this stuff out with, truly representative of different counties in Colorado, different age groups? Were the Latinx focus group members interviewed from sort of selected from folks across Colorado, or were they all from the same community? And then did we see differences across geography within Colorado in what we heard from folks? So if you can remind people of just like who it was that we were hearing from, at what point, and who was included in that.
Great questions. All of it sounds like Kyle pulled together a lot of different questions there. Thank you, Kyle. So I would say it is a nuanced answer because there were so many different phases of research. So in that first, what we call audience research that we did with the online discussion board, it was 30 people. We had a majority people of color, and they lived across the state. We had to do all online research, no in person. So I was never behind the screen on the focus group, just behind the mirror. I was always just in a secret Zoom room. And we were able to bring people together from all across the state. Now, that is to say that I don't want to suggest that we had as many participants from the Eastern Plains as we did from Denver. That's not how research works. It is a lot of work to recruit people. And so when we recruit people, I can't spend months and months and months trying to recruit all from the Eastern Plains or all from Craig, Colorado. So I'm always just looking for as representative of a sample as I can get. With our poll, it is representative, right? So it's because we're talking about larger numbers of people, and we're only talking to them for 20 minutes, and it's a different dynamic than come sit and talk on Zoom for 2 hours and come do the 20-minute poll. So I think what we found and what national research has found is that location hasn't been a big driver of difference. Race is a big driver of difference in terms of hesitancy, and political ideology is a big driver of difference with regards to hesitancy. So for many of us, we often, there was this big narrative that came out in national media that said rural people aren't getting vaccinated. And our friends at the Kaiser Family Foundation and some other national folks wanted to sort of calm that down, because it's not whether or not you live in a rural community that is more determinative. It is whether or not you're conservative or liberal, whether or not you're white or black or white or Hispanic or white and Asian. So those are the two, and those aren't the only factors, right? There's some other factors. For example, having a close relationship with someone who's gotten seriously ill or died from COVID is another predictive factor. So that may also be connected, right? We think about it as rural, but when we think about rural places that have less human beings living in them, so we have fewer cases, I'm less likely to know of someone who got seriously ill or died. So I don't want to suggest that location is a particularly determinative factor here. I hope that answered there were a lot of nuances in that question, Kyle. Feel free to follow up on any of them.
Yeah, thank you for that answer, Jason. And thank all of you for these questions that make me sound smart, so I get to be the messenger for them. You shared with the audience, Jay, sort of this recommendation for 3 steps to walk through in these conversations with folks about the vaccine, and it's to build trust, to answer questions, and to inspire hope. I want to focus in on the trust piece of that with a question that came in from the chat, and that is, if you work for a government type entity or somebody is your healthcare provider of some type, somebody that, we've heard from some of these focus groups that, people may be concerned about their motivations for having these kinds of conversations, that they may be pushing the vaccine for a certain agenda and all that. Are there things that you heard or that we uncovered through this research and this listening that can be helpful to folks who are, working in those kinds of institutions and all that? That can be helpful for them for that first phase of building trust as they have these conversations?
There's a lot for sure. Perhaps one of the most compelling things you can do is to share your own journey story. So a doctor talking about feeling hesitant and then overcoming it, right? And how do we overcome hesitancy? We got some information, we talked to doctors, we talked to family, whatever we did. Most of us don't just decide we're not hesitant. We get some information, and then we move along that journey. The reason journey sort of stories are so powerful is they model the journey we need our audience to go on, right? They're hesitant, and we need them to work through that hesitancy by getting the information they need from who they need it, so that they can make the right decision for them. So that's something that we tested. You saw Jimena do it. So we tested healthcare providers doing that. I think it would also work for folks from the government. The other thing is tone. Tone matters a lot. When we shame people, when we push them, when we get aggressive with them, when we talk about them not caring about their grandparents' lives or about their community, none of that works. And that's why you didn't hear it in the message. Fear mongering also, like big stories of people dying or getting really sick, also really backfired on people. So those are the things I would say to avoid.
Thank you for that, Jace. Our wonderful colleagues are giving me the time check warning and all that. So thank you all for joining us for this time today. We are, wrapping up at this point. We unfortunately did not have enough time to get to everything that came in via the chat, but I can say that many of the questions that I did see that we didn't get to are addressed in the resources that our colleague Austin Montoya has sent out a link to you all in the chat of where you can find this stuff on our website at the Colorado Health Foundation. And also, our work on this is not done at the Colorado Health Foundation. The places where we are making these resources available on our website are sort of living repositories of what we are learning in real time along the way. So we have a wealth of resources that are available on our website right now based off of what we've already done, what we've learned through this work, this listening, through the research itself, but then also hearing from folks like many of you on the call today who are doing this work on the ground across different communities. We have many organizations who are putting this formula to the test right now and giving us feedback about what's working, what's not, what other resources would be helpful as well. So I encourage you to check out that place where it lives on the website at the Colorado Health Foundation and to check back in the future if this is work that you're called to do in your organization going forward as well. Please be in touch with us. We want to hear what's working, what's challenging for you as well. And we appreciate your time for joining us today. So thank you, Jace, for walking us through what we've heard through a lot of listening, a lot of research, lifting up some of the resources that we have, but we recognize that this is complex work that is ongoing across our state, and we appreciate you all for joining us today. Thank you very much, and we hope that you enjoy the rest of your days.